I
Got
believe
it.
we all think deeper, that everybody has different ways that they have a hard time letting things, memories, beliefs, identities go. In that way,
Okay.
we will relate. We need to go deeper to understand the psychology behind the behaviors and the psychology behind the what you can see, because how people
Mm,
feel and even the trauma background people
mm,
experiencing hoarding experience, and this is kind of like how this behavior evolves. Those are
mm,
and those
mm.
are sufferings that we should not make fun of or take light. My name is Chia-Ying Chou. I'm a clinical psychologist. I am based in San Francisco Bay Area, and I also offer trainings and workshops to just the general public, people experiencing hoarding, and clinicians who want to learn more about hoarding or compassion focused.
I was thinking we could start with just kind of societal context right now. I was thinking about the word hoarding, and the most common use that I hear it is usually when people are kind of poking fun at someone or trying to kind of passively aggressively address an issue that someone that they care about has, and that it's usually received in a little bit of a defensive way. But then on the flip side, we have shows that are really popular, like Hoarders. And then we have the work of Marie Kondo that has become very popular as well around cluttering. So I was wondering for you, where do you feel like society is at in terms of understanding hoarding?
Yeah, that's a very good and very important question, right? And feels like people, where we are in the society is that we're only seeing the stuff. We're only seeing the
Mm,
surface of what we
mm,
call hoarding, right? When we think about hoarding, we think about stuff. We think about
mm,
stuff piling up here and there. We think about congested pathways and piled up sinks and paperwork in the middle of a room, just like
mm,
what it's portrayed on the TV shows. Yeah, and
yeah.
that's very unfortunate. And that's where the stigma comes from, right?
Mm,
So
mhm,
if we really check in with ourselves, don't we all have something that we have a hard time letting go of? The difference is
mm,
some people, what they are not able to let go of are something that's physical, that's
mhm,
visible. However, if we all have the empathy to understand the wanting to grasp on something to feel safe, wanting to grasp
mm,
on an idea or identity to feel better about ourselves,
mm,
it's
uh-huh,
actually very relatable.
mm. So this kind of behavior of holding on to something, it's a form of feeling safe and protected and secure.
Right, right. Yeah, we
Okay.
are not, we need to go deeper to understand the psychology behind the behaviors and the psychology behind the what you can see, because how people
Mm,
feel and even the trauma background people
mm,
experiencing hoarding experience, and this is kind of like how this behavior evolves. Those are
mhm,
and those
mm.
are sufferings that we should not make fun of or take light of.
So, in the definition of hoarding, I was curious what the line is between hoarding and just keeping a lot of possessions.
Yeah, another very good question. Yeah, so there's this question about what's the difference between collecting, it can be just like collector, or
Uh-huh.
what about clutter? What about
Mm,
hoarding? So the three words, collecting, clutter, and hoarding. I think the difference here, the main difference here that makes hoarding stands out is the strong emotional distress if
mm,
were to part with or discard their possessions.
uh-huh.
And also the kind of like lack of organization and for example, when somebody collect some things, For example, you have people collecting shoes, people collecting watches, people collecting stamps. And so these are usually specific kinds of things. And when
Mm,
a new item comes in, they have a place to go. Whereas for
right.
people who have a hard time letting things go, which is
Uh-huh.
what we currently call hoarding, usually things don't really have places to go. And if people were to ask you to discard your
Mm,
things, you will feel it's almost like it's very anxiety provoking, makes you feel very uncertain, very threatened, and very
mm,
sad. Yeah, and so
mm,
that's the differentiation between just having stuff versus hoarding. So which
mm,
having stuff is more about the clutter. And we need
mm,
to know what's the nature of the clutter. Is it just because the person is too depressed to sort through things? And if you offer, hey, can I come to your house and sort
mm.
through things and discard things for you? Some people may say, yeah, I really want
Wow.
to do that, but my knee is just having
Mm,
so much pain, so I can't physically do that. So
mm,
the level of willingness to let go is how we differentiate
mm.
clutter versus hoarding.
So there's an emotional component that is
Exactly.
almost kind of like the line to measure when it's crossing into hoarding.
Exactly.
And that makes sense that if you were like, can I help you with this? And it was just kind of someone experiencing it as a mess, for example, that they might be like very open to receiving help. Whereas
Right.
it sounds like with hoarding, um, help feels threatening.
Yeah.
Okay, which makes your work very interesting to meet people with help for hoarding when that is part of what triggers their
Exactly.
anxiety.
Exactly. Yeah. So a lot of people are kind of like, so for people experiencing hoarding, they go through so much before they finally knock on somebody's door, say, hey, I have this issue, I need help,
Mm,
right?
mm,
There is this long journey about like looking at hoarding as hoarding and identifying this is something that I do experience and I need professional help with. So
okay.
seeing that this is a thing, this is not just because I don't have time or not just because I'm lazy or sloppy, right? And so
Mm,
recognizing this is a mental health challenge that I'm going through.
mhm,
Then okay, after realizing this, some people still go back and forth and thinking, I should be able to do this myself. Like it's just
mhm,
stuff. How hard it is to throw it away. I should be able to do it myself. Other people are able to throw
mhm.
away things themselves. Why can't I? Right?
Uh-huh.
There's this a lot of shame associated with this because people don't
Okay.
accept that this is a mental health issue.
And it sounds like that's a different stage. Um, what does it take for someone to get to the stage of being open for help or even being able to identify? Because I'm thinking in most like common um, conversations, hoarding isn't presented as um, something that people can do something about.
Hmm.
Or on the flip side, there's a lot of denial, or again, that kind of, I don't need help. I don't want help. This is totally fine the way it is.
Mhm.
So, what usually gets people to that second stage?
Yeah. There are several things that I have heard and several things that I think may be the reasons why people start to get help. One is a very common one that I have come across is family or friends
Mm,
in the right way, not
uh-huh.
unhelpful way, communicating persistently and patiently with
Mm,
their loved ones experiencing hoarding. Yeah, because
mm,
often, like you can imagine that, especially for somebody who is living with this individual, they
right.
this is a source of conflict, right? And even a source of blame, a source of like you are a nasty person, right? So how is
Mm,
that gonna help their loved one be open
Mm,
to receive help. However, I
right.
do see a lot of successful kind of like examples of their loved ones being able to kind of like gently bring awareness, bring some psychoeducation that they can search on the internet and to kind
Mm,
of like have the non-blaming and non-judgmental kind of information and the way of presenting the information
mm.
to the person.
Yeah. So, I mean, it makes me think of most mental health experiences.
Right,
It's kind of like usually when we're experiencing a mental health issue, we don't even have the imagination to think that this could be different.
right,
And then someone kind of comes into our life and is like, hey, you don't have to experience life this way. But if it's done in a critical, kind of critiquing way, it activates that defense mechanism.
yeah.
Okay. So it's usually just someone bringing the attention rather consistently that this could potentially be a different experience and in a loving way.
Yeah. Yeah. And I've also seen people who just realized it themselves by
Okay.
accessing information on the internet,
Uh,
educating themselves, and trying to find answers to their issues.
so what would you say is the difference between someone who continues this behavior forever and then someone who eventually decides they want to change?
Mm. I think there are some very key things that I can identify. One
Okay.
thing is the courage to see the reality as is, right? So
Mm,
if we have any problems, we can just do this and then
mm,
try to go around it and not look at it.
mm.
And it takes courage to see the issue as an issue,
Yes.
right?
Totally.
Not just courage, also the kind of like emotional strength for you to be able
Mm,
to face this is an issue and also the self-compassion or self-care. Like do I care about myself enough
mm,
that I know this is the issue and I want to do something about it.
mm. I mean, courage is, I feel like one of the biggest metrics for change in general. Um, but I haven't thought about it as the courage to see hoarding as kind of what it is,
Mhm.
that this is actually not creating an identity that I think it's creating for me, or it's actually not creating preparedness and readiness in the way I think it is. Um, so much of mental health is like identifying almost what is creating what is the illusion that we think we're creating by this behavior that is actually not really creating what we think it is. It's not meeting the real need.
Exactly. Yeah.
Yeah. Okay. So courage and then compassion.
Hmm.
One thing I was curious about is there technically different types of hoarding,
Mm.
like classifications in terms of sentimental or preserving history or um, more scarcity mode around amenities? Is that part of your practice, kind of identifying the types, or is it more just looking at the psychology of what's instigating the behavior?
Yeah, that's a good question. Well, currently, there isn't kind of like a clear different types of hoarding. However,
Okay.
we do see people with different kind of clinical presentations. You when you
Hmm.
see hundreds of people experiencing this
Right.
diagnosis, you can see, oh yeah, there's some kind of different flavors of
Hmm.
experiencing these things. Yeah. And but I would say though, a lot of times like the different things that you identified just now, like the sentimental or wanting to preserve some information or wanting to, so coming from a more scarcity mindset, I feel like people have a little bit of different things. And it's kind of like the proportion is different among
Okay.
people.
Okay. So maybe the research on hoarding is still relatively new. So I imagine the nuance of the different psychology for like what is the stimulus is
Yeah.
not quite clear yet.
Yeah. And there are definitely a lot of different stimulus or different processes that have been identified, but not to the extent that we then classify people to, okay, there are three types. Yeah,
Oh,
because
okay.
people usually have mixed of these. I can give you some examples.
Yeah.
Like, for example, like you said, so there's some uh, like to preserve things because of sentimental reasons. For example, like things that are inherited from family members that have passed
Mm,
away, or clothing or things the person used when they were younger or a different period of their life that
mm,
maybe for them is the meaningful or the highlight of their life. Yeah,
mm,
are kind of
mm.
sentimental reasons. And there are also people who are holding on to things for the use of things, such as
Um,
information. There's digital hoarding. That's a new thing now, as you can.
okay.
Yeah, and there's also like books and magazines, newspapers, articles, cookbooks. Yeah, so that these are things that makes people feel more ready. So they
Mm,
protected when they have information. And when something in the future comes, oh, if a situation, yes, I read that article, I can refer back to it. Yeah, so that's usually kind of like the logic of like I need to save this because it may turns out to be useful or even protect
right.
me down the line.
Mm,
Are like kind of examples of two types. And there are also people who kind of like if you ask them, they will tell you reasons why they need to hold on to this thing, but you can kind of sense that it's kind of like a trauma response. And some of my
mm,
clients, they actually can be aware that it just feels like being surrounded by stuff just makes them feel safer and less lonely.
mm.
Yeah,
So there's like a relational component of the stuff needing some sense of connection.
exactly. Yeah,
Okay.
yeah.
So it sounds like a part of treating hoarding is really exploring and helping people become conscious of what do these items, what feeling does it create in you? Like if you continue to buy or keep something, what is the emotion that it's preserving?
Hmm. Yeah,
Yeah.
the function of these things and the fun
Yeah.
keeping and saving these things.
I imagine most of society associates hoarding with what you were calling readiness, which that word is so illustrative of like being prepared for the future. Like I might need this item in the future, even though I haven't needed it in the last 5 years. I'm going to save it because it possibly is functional. But
Mm.
that there's this other component of hoarding that might be meeting a different need of comfort or it sounds like that one is a little bit more infinite in all the possible ways that someone might feel by having a different item.
Right. Yeah, there's the comfort about like things from the past that reminded me of who I was in the past, or a gift
Uh-huh.
from a friend that reminded me that I was loved by this friend, or
Oh.
even some things that makes me feel like, well, I am this kind of person. For example,
Mm.
we sometimes when we talk about kitchen gadgets, people
Huh.
have people have different kind of kitchen gadgets, right? Or watches or clothing, right? And if even for people without hoarding issues, we look at these items, they kind of gives us a hope or a glimpse of the kind of lifestyle that
Mm.
we have. right? If you look at the
Mm,
advertisement, oh yeah, well, I have this kind of certain kind of coffee maker. I'm using this, and look at my life. Yeah, so
mm,
item is not just a functional thing. It
mm,
represents a dream, represents
ooh,
identity, right? And so
ooh,
when we feel bad about ourselves, we hold on to these things and makes us feel better temporarily about,
oh. Oh, that's so interesting. I haven't thought of the tendency to hoard as a way to create an identity.
yeah,
And
or
then I guess,
better,
say that again.
to feel better.
To feel better ultimately. Yes. And part of that could be like your self-concept, how you think about yourself.
Yeah.
Okay. Oh, that makes so much sense. And that kind of broadens the scope too of there's a lot of variety for different ways people are coming to this behavior.
Hmm.
Okay. Which brings me to the workshop that I saw that you're offering, um, the compassionate mind training for hoarding and cluttering. And I
Hmm.
was so interested and excited when I saw this, for two reasons. Just another mode to treat an issue rather
Hmm.
than one-on-one therapy, giving people more options.
Right.
And then also, I've never come across a group for hoarding. So treating hoarding and cluttering in a group context.
Mhm.
Um, so I was curious just to start, when did you begin offering this workshop?
Hmm. So, compassion to mind training came from compassion focused therapy. So,
Ah,
so
okay.
like kind of like a sibling or a cousin of
Yeah.
a particular form of therapy. And compassion
Mhm.
in mind training is done in the format of psychoeducation and skills training, and therefore it's a workshop. So we teach
Mm,
people skills and practice these skills in the workshops. However, we can't dive into something like the trauma history or unpacking something deeper, like how we would in CFT, the compassion focused therapy groups.
mm,
Yeah, so we have done, I've been doing compassion focused therapy groups specifically for hoarding since 2016.
oh,
And
wow.
yeah, and it's then after many years, then since last year, we started to offer compassion in mind training workshops for people.
Mm,
Reason why that is because I'm only licensed in California. I can
mm,
have people in California join the compassion focused therapy groups because it's therapy. I
uh-huh.
know that there's a lot of people outside of California that could
Mm,
benefit from this approach.
right.
And therefore, we open the workshops online, and so people can join from anywhere in the world.
Ooh, amazing. So part of the workshop was to widen the doors, open for more
Exactly.
people.
Exactly.
Okay.
Yeah.
And what would be kind of the end goal, of someone wanting to sign up for this workshop? What can they imagine that they would get out of it?
Yeah. I think one of the biggest goal that we are aiming for is to offer a different lens of looking at this issue for people.
Ooh, okay.
And the different lens means we're trying to understand why we have this issue from
Mm,
even the evolutionary psychology kind of point of view, like
mm,
understanding how our brains are wired. Because
uh-huh,
this is an evolutionary product, and we think we're supposed to be rational and capable because we are humans. But
uh-huh.
truth is that we have a lot of very still very like animal-like part of our brains that
Yes.
hijacked our rational
Yeah.
brain. And our emotions are not supposed to be logical. And
Mm,
these things, and a lot of for example, starting from the how your brain is wired and your genes and your early
mm,
life experiences that shaped who you are and the difficulties that you will find difficult, that is
mm,
not something that you chose. And so we want to come from this more like holistic or more, in my mind, more accurate and more objective way of looking at the issue that you face. So it's not your fault that you have
Mm.
issues. It's all of these different factors piled up, and now you have this issue, and how do you work with it in a way that's not like just saying, I am just lazy, I am just this. No, you didn't choose this. Then how do we do this now? That now
Okay.
to deal with this.
So this first part is people who come to join your group workshop. Um, it sounds like there's a necessary requirement of some degree of curiosity.
Mm-hmm.
Is
Indeed.
that true? Okay.
It's
So someone who's not curious, if they're like resistant, then they might not be a good fit for the group, or would you still work with that?
I will still be open to that, right? Because I'm
Okay.
curious. I'm curious if they were
Mm,
more curious as the result of the workshop.
okay. So you're
Yeah.
open to people that are like a little bit in the doubter
Yes.
category. But then it sounds like the majority of people that are coming in are genuinely curious about their behavior.
Mm-hmm.
Yeah. Okay.
Yeah.
And then it sounds like the next phase is around skill building. Is that true?
Exactly. Yes.
Okay.
Yeah.
And what types of skills can people expect to practice or build?
Yeah. So we will talk about how to recognize our emotions or the state that we are in. So we'll talk about sometimes we are in the
Mm,
state of fight and flight.
mm,
Sometimes we are in a state of like very driven and almost like our adrenaline is very high. For example, like we see a sale sign or we see something that's on the street. We see
okay.
potential in it. We get very excited and have a million ideas about how to use that thing and bring it home, right? So we help we're teaching some kind of skills to and some kind of like psychoeducation frameworks for us to know where you are, where is your state of
Mm,
mind, where is your state of being, and
mm,
then we also teach people different kind of techniques like to regulate yourself, to bring yourself back to center, to more balanced place, like
mm,
using rhythm breathing, like how to use your body to calm your mind, and even
okay.
how to engage in talking with different parts of yourselves.
Ooh,
For example,
okay.
if making decisions about whether to keep this item or to let it go. There's a
Mm,
part of you. The reason why you're trying to make this decision is because there's one part of you at least wants to let it go. But then as
mm,
that
mm,
idea comes, then there's this more strong part of you trying to convince you, no, but we can save this for something, for this situation. No, you can't do this because X, Y, and Z. So we
mm,
have some ways to help us kind of like identify, okay, there are multiple parts of me. How can I get to hear
mm.
every part's concerns and where they're
Ooh,
coming from? And then I can develop a wiser part of me who we call the compassionate self. Uh,
mm,
Obviously, also cultivate that part, that's the compassionate self, who is in charge to understand, okay, like, okay, I hear you, fear, I hear you, self-criticism. Okay, I'll
mm-hmm.
hear you, sadness. And then now,
Uh-huh.
the leader of the group, what do we do?
Ah, yes. Just like it sounds like a lot of mindfulness training, but specifically in the context of assessing, keeping things, buying things, letting things go.
Yeah, a lot of mindfulness training, a lot of somatic exercises, and a lot of parts work as well.
Okay.
Yeah.
So if you were talking to a non-clinician,
Mm-hmm.
just someone that you're passing by on the street and somehow you got into a conversation about hoarding and they identified that they had this issue or
Mm-hmm.
they were curious about having this issue,
Mm-hmm.
how would you describe the group to them
Mm-hmm.
and the reasons that they might want to join? It might be similar, but I'm curious, like, how do you help someone understand the value that
Right,
doesn't understand therapy per se?
right, right. Yeah. Well, I think that the main thing or the most important thing about joining this group and how this is different from other groups of people joining for hoarding is that this will give you a different way of relating to this issue, right? So you can join other groups and you're going there wanting to change how you think and wanting to fix your hoarding issues. So there's a lot of fixing related resources there, and they're great because some things can benefit from some fixing and some things can benefit from some changing. Yeah, but I think that if you experience a lot of self-criticism and a lot of like shame around this issue and frustrated with yourself, I think you need to take a step back and maybe understanding it from a different way. First, accepting and coming from a more self-compassionate place to understand why you experience this issue and really get to know you didn't choose this and really get to know a more friendly and supportive way to work with yourself rather than a like goal setting. Why can't you do 15 minutes of discarding? Why can't you throw away 10 things? So another main difference of this group is that we're really following our value, which is that treating hoarding or working through healing hoarding is not about getting rid of stuff, more about resolving and recognizing and resolving the knots in your heart that leads to the behavior of holding on to stuff. And the releasing of stuff will be a natural outcome of you working through the heart.
So the most poignant part of this group, it sounds like this workshop it sounds like exploration. Is that fair? Like exploration, getting to know yourself. Almost like making space to investigate on your own. How do you feel about these things and actually making space to get to know yourself in this way?
I would say that that's the first step. Yeah.
Okay.
Yeah. And I would even say that that's step 0. So kind of back to what you were asking earlier about the kind of people that would be the best fit for this workshop is people who are curious. So people who already kind of like is willing and making space to try to want to be curious about why am I having this issue? Because most people, you are actually pretty smart people. Like it's not like you are like a contributing member of the society. This is not something that you are just doing this intentionally to hurt yourself, right? It's not because you're not intelligent, right? So why do I struggle with this? I'm a smart person. Can I take all my things? So I think that self-exploration or the question is something. It's almost like step 0 that we hope that our participant they have before they join the group.
Okay. Okay. So then talk to us a little bit about the group setting. What would a session look like where, people in their mind, they have an idea of one-on-one therapy, but it's less common that people have an idea of what it would be like to be with other people who are also interested in working on this.
Yeah. Yeah. So the workshop is online. And so usually we have maybe 10 people joining the workshop. And so we have people from all over the world. In the last year, when we did it for the first time, we have some people joining from Europe, some people from different parts of the US, and one person from Canada. Yeah. For example, in a one-on-one setting, whether it's coaching or therapy, you only know your issues. And so the
Right.
most valuable thing about being in a workshop or joining a therapy group for hoarding is that you get to hear other people's experiences.
Hmm.
Other people, especially for people who is the first time that they are seeking treatment for hoarding or seeking resources for hoarding, this is so liberating. They realize that they
Hmm.
are not the only person who experienced this, and they get to hear other people's experiences and get to understand and be understood by people
Hmm.
who share similar challenges. Yeah, and that
Hmm.
itself is a very de-shaming process.
Right. So that kind of opens up space. It's like as a human and as a therapist, I get why that's so powerful, but I almost find it hard to put into words why it's so medicinal
Mm.
to be with other people and hear their stories. Is it mostly just related to shame and belonging, or is there another element in there?
Yeah, I think shame and belonging and also connection, right? I think
Hmm.
belonging is part of connection, right? You feel
Yeah.
like you can reveal who you really are and be
Uh-huh.
accepted as who you really are and
Yes.
connect and be connected as who you really are. Because most
Uh-huh.
people who experience hoarding, they don't talk about this with most of their friends. So
Hmm.
they experience an extra layer of loneliness because they
Mm.
can't share this, even with
Uh-huh.
some of their close friends.
Right. So that degree, that acceptance
Yeah,
piece. Ooh, yes, that feels deeply meaningful.
right.
And I imagine it's also what's kind of scary about joining a group.
Excellent.
Um, yeah, what reasons do you feel like people are reluctant to join groups? Is it mostly that piece of afraid to share? And then how do you help people make that leap to feel like it's worth it?
Yeah. Well, I can also see that joining a group or a workshop is more intimidating than talking with a therapist one-on-one,
Yeah,
right? You
right.
feel like I'm just disclosing this with one person, and this is a
Uh,
professional person that I'm sharing this with. So in some way, for some people, that feels safer,
mhm,
right? But
mhm.
to be honest, if that's where you are at, that's great. That
Right.
because people have different starting point, and
Yes.
so that's also a great approach. The
Right.
thing is though, there aren't currently a lot of specialized therapists out there for
Mm,
yeah.
mhm,
So that may be some of the limitations that you will run into.
mhm.
Yeah. But
That
that
makes sense.
aside, yeah, that aside, um, being in a group setting, whether it's a workshop or a therapy group with people who are experiencing the same thing, I think that most likely everybody in the group are gonna be on the same boat about
Mhm,
kind of like wanting to connect, but also scared, just like you.
mm,
So
mhm,
you're not gonna be the only person who feels that way. And
mhm,
my experience of seeing groups unfolding is that usually you can see that the first session people are kind of timid and
mhm,
more holding back. But
mhm.
second session on, really, this population are made of people who have big hearts.
Mm.
Yeah, just like you, who is, if you are listening to this, just like
Uh-huh,
you care about other people so much more than yourself.
uh,
And so you're gonna be with a bunch of people who are just like you, and it's really, really easy for the
uh-huh.
fund to build in this kind of group that I have facilitated.
Mm.
Very beautiful to see.
Yeah. So I haven't thought about that before, imagining the people as having a similar demeanor in terms of attachment and wanting to feel safe and secure and good. And
Mm-hmm.
it sounds like a sensitivity,
Right.
right? So other kind of people who are meeting the same need, but in a different way. Um, okay. And I'm not sure exactly how to phrase this, but I have found with group work, there is an element, even if it's a very sad or challenging or difficult topic, there's an element of group work that is social, and fun might be the wrong word. I haven't found another word for it, but as someone who's led different groups, usually people start looking forward to them.
Mm-hmm.
Um, do you find that's the case for you? And what would be the way that you describe that?
Yeah, that is certainly the case. Yeah, that is certainly the case. So so the workshop that we are doing in July, it's a six session workshop, so 6 weeks long.
Okay.
However, we also do therapy, CFT therapy group in my practice for Californians. Yeah,
Uh-huh.
that's 20
Yes.
weeks long.
Uh-huh.
You would think that the 6 weeks long is not gonna form that kind of like supportive vibes or like of the sense of belonging.
Yeah.
That's not true. Yeah,
Mm.
I hear people saying like maybe week 2 or week 3, they say, "Oh yeah, I had a hard day today. I was thinking about not coming, but I thought about all of you here, and that made me decide, well, yes, my I'm having a cold, but I'm just gonna come." And
Mm.
I like hearing what you have to say, and the
Uh-huh.
meaning not just me, but also the mostly the group members.
Right. Yes, they start looking forward to kind of seeing each other, hearing where they're at on their journey, sharing
Right,
their stories of progress and difficulties.
right, right. And they also make friends. Yeah.
Yes. That's beautiful. So in your workshop, they're allowed to make friends and connect and stay in
Yes,
touch.
yes,
Okay. Okay.
yes. If they
So
need to.
if they
It's
want to, got
right.
it. Beautiful. So if someone is listening and they're thinking of someone in their life or a family member that they see exhibits the signs that you talked about, where they get anxiety and stress and just emotional turbulence at the idea of letting go of stuff in their life,
Mm-hmm.
amenities, all these different items. What would be your advice on how to bring up the issue, talk about it, and present this workshop as an opportunity?
Mm-hmm. Yeah. Well, I think I think one key thing that I would like to emphasize is to listen more and
Mm.
and asking questions rather than jumping into giving advice.
Ooh, yes.
It's
Hard to do sometimes.
so
Yes.
hard. It's so hard. Yeah, and I know that you're saying, how do we bring up this workshop? And I'm saying, well, maybe not bringing this up just yet.
Mm.
Giving you kind of
Uh-huh.
like opposite thing that you probably expect to hear from me. But I think that
Uh-huh.
generally I would say that because this is such a sensitive thing, right?
Yeah, right.
There's a lot of sensitivity around, well, the word hoarding is a loaded word, right? And
Mm.
people may think that you're calling me a hoarder, right? And then that's a lot of loaded word and very
Mhm.
stigmatized word. So
Right,
that
right.
itself is sensitivity, is sensitive. And
Mhm.
also even for people who can can identify that they do have difficulties letting go, then a lot of people they may feel like, well, getting any kind of help for hoarding means getting rid of my stuff and being forced to do
Ah,
right.
ooh,
There's that added layer of sensitivity there about like this
yeah.
stuff means a lot to me. They are even like my family. They're just like
Uh-huh.
family and friends. Yeah, so
Mm.
there can be defense there.
Mhm.
Also, I think for most people, even for mental health professionals, there's still a lot of things that we don't know about hoarding. So
Yeah.
that's why I would say, well, being a curious
Mm,
friend and create
mm,
safeness, create like
okay.
this atmosphere, like, oh yeah, if you're talking about it, this is something that we can talk about without me questioning, why do you have this? Or you haven't
Mm,
used this for a long time. Why are you keeping this? Right?
mm,
When I say ask question, I'm not saying asking these kind of like pointy question, like why do you not want to get rid of your stuff?
mhm,
It's
uh-huh,
like, what does the stuff mean to you? Oh, tell me
uh-huh.
more about the story behind it. Oh, tell me more about your concerns. Oh,
Mm,
that makes sense. And try to understand that. Yeah.
mhm,
And if you feel like yeah, the connection feels safe. Like the person feels that they also say, yeah, I kind of have mixed feelings. And on the one hand, I want to keep it, and I really have a strong feelings about of attachment to it. But on the other hand, it's kind of hard for me to find things, and I can't use my space. When
mm,
you start to hear signs or hints like this, then that may be a better way to enter with, hey, I saw this. Just FYI.
mm,
Yeah. So
mm.
just FYI and no pressure.
Okay. So if I was to summarize that, it sounds like first, remember that this is a sensitive topic.
Mm-hmm.
And I think kind of going back to where we started today, the word hoarding is kind of thrown out as a slight jab or a little bit of a criticism.
Yeah.
And so backing off from that and remembering that most people are sensitive to the things that they have. Most people who hoard have a sensitivity around the subject area. So just starting with like softness in that department. And then it sounds like um, being curious and listening to how they feel about it and how they experience it. Do they experience it as difficult to find their things? Do they experience it as stressful at all? Do they experience making decisions as being challenging?
Mhm.
And then it sounds like lastly is mention that you saw that there's a workshop or a tool, but not that it's pressure to do it, but that there's options, that there exist people that work in this space and love it and are passionate about it and interested in helping people explore.
Yes. Thank you for summarizing
Yes.
it.
Okay. And just that fourth piece, too, that I think is really interesting for this group, and I think would be an easier way for people to get in the door, is that it's actually not about forcing or having a super hard goal to get rid of stuff.
Yeah.
Just beginning to understand, like, how does this space feel for you?
Right. Right. Yeah. I think that for that reason, it's really perhaps helpful for people who are in the beginning phase of wanting to understand, wanting to work through um, their difficulties with hoarding or cluttering issues.
Uh, like they're ready to open the door.
You're ready to open the door.
Yes. Okay. And then just tell us, when is your next workshop?
Uh,
Um,
yeah, let me see. The next workshop is there are 6 Mondays and it's 2.5 hours long. It's starting from 9:30 a.m. to noon Pacific time, and it's online. If you are really interested in the workshop and you really need financial support in order
mm,
to join, and you can email us. We have a limited amount of scholarship to support people.
mm,
And
oh,
so,
beautiful.
yeah, so email us and then we'll let you know if there's a line for the scholarship.
Okay. Amazing. Well, thank you so much for meeting today and taking time to explain to everyone what the work is that you do and tell us about this beautiful workshop. I think it's beautiful and so important that people know all these different options for exploring and treating hoarding. So thank you for the work you do.
Thank you.
Um, Yeah, and I'm looking forward to hearing about how the workshop goes.
Sounds great. Yeah, thank you.